What are the most unusual epilepsy seizure types? Have you ever wondered about the different types of epilepsy seizures? While many people are familiar with common seizure types, some are quite unusual and can be surprising. Understanding these unusual seizure types is important for recognizing and managing epilepsy effectively. One unusual type is the atonic seizure, often referred to as drop attacks. During these seizures, a person experiences a sudden loss of muscle tone, which can lead to a sudden collapse. This can happen without any warning, making it potentially dangerous as it can result in falls and injuries. Another type is myoclonic seizures. These are characterized by brief, shock-like jerks of a muscle or group of muscles. Myoclonic seizures can occur in isolation or in patterns that are less common. Sometimes, they may be subtle and mistaken for normal muscle twitches, which can make them tricky to identify. Gelastic seizures are particularly rare and involve sudden, uncontrollable laughter that has no apparent cause. This laughter is involuntary and often seems out of place. Gelastic seizures typically originate from specific brain structures, such as hypothalamic hamartomas. Dacrystic seizures are even rarer than gelastic seizures. They involve episodes of crying or sobbing without any emotional trigger. Like gelastic seizures, they arise from specific areas in the brain and are considered highly unusual. Automotor seizures, also known as complex focal seizures with automatisms, involve repetitive, involuntary movements like lip smacking or fidgeting. During these seizures, the person may appear conscious but is unaware of their actions and has no memory of what happened afterward. Some focal seizures can start with unusual sensory experiences, such as strange smells or visual distortions. These sensory seizures can be quite specific and are tied to the area of the brain where the seizure originates. Infantile spasms, also known as epileptic spasms, are typically seen in infants. These seizures involve sudden flexion or extension of the limbs and trunk. They are unusual due to their age of onset and are often associated with developmental challenges. Reflex seizures are triggered by specific stimuli, such as flashing lights or even certain thoughts. This makes them unusual because they occur in response to identifiable triggers rather than happening spontaneously. Lastly, psychogenic non-epileptic seizures, or PNES, can mimic unusual seizure types. These involve complex behaviors or movements but do not show the electrical brain activity typical of epilepsy. It is essential to distinguish these from true epileptic seizures for proper management. Recognizing these unusual seizure types is crucial for accurate diagnosis and treatment. Each type has distinct features that requiring careful clinical attention. If you or someone you know experiences seizures, it is important to consult a healthcare professional for personalized advice and management. Understanding the variety of seizure types can lead to better outcomes and improved quality of life for those affected by epilepsy.